Have you ever tried to book an appointment with a specialist, only to find out the wait list is months, and I mean months long? It's so frustrating, right? But what if I told you that sometimes that unavailability isn't just because the doctor is popular? What if it's a deliberate strategy? Okay, let's get into it. We've all been there, asking this exact question. Is the healthcare system just broken? Are there too many patients? Or could it be something else entirely? Well, the source material we're digging into today suggests there might be a secret playbook at work, a psychological strategy designed to make you value that doctor's time even more. So, according to our source, practices tend to fall into one of two buckets. On one side, you've got what they call the lazy practice. You can call, you can walk in, you can see the doctor pretty easily. But on the other side, there's the busy practice. And here, getting a same-day appointment is basically impossible unless it's a huge emergency. Now here's the twist. The surprising part isn't that these two types exist. It's that a practice might actually choose to become the one on the right, on purpose. Right, and that choice to be the busy practice isn't some happy accident. It's a strategy rooted in a really powerful concept called takeaway selling. And it totally flips conventional wisdom on its head by making something harder to get. So what exactly is takeaway selling? Well, the idea is deceptively simple. You make something less accessible to make people want it more. It's a psychological trigger. By restricting access to their time, these doctors are betting that you, the patient, will automatically see that appointment as way more valuable and desirable. And the thinking behind this is captured perfectly right here. It taps into a fundamental part of human nature. When something is rare or hard to get, our brains just automatically assign it a higher value. It's an instinct that kicks in whether we realize it or not. And get this, the source material we're looking at presents this strategy as a kind of closely guarded secret. It's something that's only shared with a very select, hand-picked group of clients. Yeah, this isn't something they teach you in business school. A big part of its power comes from its mystique. Okay, so let's get into the nitty-gritty of why this whole thing is so effective. It all comes down to a few powerful psychological principles that are hardwired into us, and, it turns out, are surprisingly easy to leverage. These are the 5 pillars that make the whole strategy work. They're a mix of classic economics and some really clever perceptual tricks, and they're all designed to create this feedback loop, where scarcity and demand just keep feeding each other. Let's start with one we all know, the law of supply and demand. It's simple, right? The relationship is always inverse. When the supply of something goes way up, demand for it tends to drop. But, and this is the key, when that supply goes down, demand shoots through the roof. You can see it perfectly right here. When the doctor's supply of available time is high, patient demand is, it's fine, it's low. But the second the practice intentionally shrinks that supply, bam, demand skyrockets. So the strategy doesn't start by trying to create more demand, it starts by creating less supply. And here is the absolute kicker. The whole thing hinges on the fact that the scarcity isn't always real. According to the source, a lot of the time, it's completely manufactured. The practice isn't actually drowning in patients, they're just creating the impression that they are by deliberately limiting your access to them. This is where that old saying, perception is reality, really comes into play. If you believe a doctor is incredibly busy and in high demand, you just automatically treat their time as more valuable. You're way less likely to question their fees, you're more likely to follow their advice to the letter, and you'll patiently wait for that golden ticket, that coveted appointment slot. Okay, so the theory makes sense, but how does a practice actually pull this off? Well, the source lays out a very specific step-by-step playbook. It's really a journey with a bunch of hoops you have to jump through. First, you call and you don't book an appointment. You get qualified. You have to answer questions to prove you're a serious candidate. Then, instead of just booking you, they send a physical report in the mail, not email, making you wait. Then they call you back, but not to sell you, just to talk about the report. If you're still interested, now you have to fill out this huge questionnaire. Every single step makes you invest more time and effort. So by the time you finally get in for the consultation, you've already convinced yourself of the doctor's incredible value. And the results of this whole process? They're kinda staggering. The source claims that by the time a patient has jumped through all those hoops and is finally sitting in front of the doctor, 80 to 90% of the selling is already done. The patient is sold before the doctor has even really started. It all boils down to this really counterintuitive piece of sales genius. The less you try to sell, the more they want to buy. By making the whole thing a challenge, the practice creates an environment where the patient feels like they're the one pursuing the service, not the other way around.
So what's the big payoff for creating this busy practice persona? Well, according to the source, it's designed to be a win for everyone involved, both the practice and, psychologically speaking, the patient too.
I mean, for the practice, the benefits are pretty obvious. The process naturally weeds out anyone who isn't super committed. It attracts patients who won't bat an eye at high fees. And of course, it builds this bulletproof reputation for the doctor as an exclusive, top-tier expert. But what's in it for the patient? Well, the argument is that after working so hard to get in, we subconsciously justify all that effort. Our trust in the doctor goes way up. We feel special, like we're part of an exclusive club. And, maybe most importantly, we're far more likely to actually follow their treatment advice, which, in the end, could lead to genuinely better health. And all of this leaves us with one last, fascinating question to chew on. Is this strategy a brilliant use of human psychology that actually benefits both the doctor and the patient? Or is it just a really clever form of manipulation that preys on our built-in biases? It's definitely something to think about the next time you're told a doctor has a 6-month wait.